that's very, very exciting, I think. I think we're all very excited by that. And we'll definitely be looking at integrating that into Climate Week NYC. I mean, when you look at all those names, you reflect on all the people in this room, and we've got the backing of senior politicians, and we've got the backing of senior leaders in so many different other industries as well, and young people and activists and some of the smartest minds in the world. You sort of think, looking at the idea of hope, fighting climate change, it stopped becoming a thing that we can win. It's become a thing that it would be really embarrassing if we lost this. Like, we had no excuses. But anyway, I'm going to introduce the next panel now. It is entitled Climate Change and Health, Understanding Risks, Impacts, and Equitable Solutions. This panel will delve into the multifaceted impacts of climate change on health, while also exploring equitable solutions to address these challenges. And moderating this panel will be Susan Anenberg. Susan is a professor and chair of the Environmental and Occupational Health Department at the George Washington University Milken Institute of Public Health. She is also the director of GW Climate and Health Institute. So please welcome them to the stage.
Okay, thanks very much. I'm just going to sit right here. Great to see you all. So my name's Susan Anenberg. I'm from George Washington University. I direct the Climate and Health Institute. I'm the chair of the Environmental and Occupational Health Department at the GW Milken Institute School of Public Health. You know, earlier today, I taught 2 classes, Climate Change and Air Pollution, from Science to Impacts to Solutions, back to back. We actually have 3 sections of this class, and I've been teaching it for 7 years. And on my bike ride over here, coming from class to here, it really just struck me how far we've come. It's really, really exciting to think about this. When I was a graduating undergraduate 20 years ago, not to date myself too precisely, there really weren't that many programs you could go to learn about climate and health. That was my passion. I connected the dots when I worked overnights as an emergency room technician at Evanston Hospital, when I was a student at Northwestern, and I was an environmental science and biology double major, and just pulling all the pieces together about how we should be thinking about how the world around us affects patients' health, and how we can think about preventative care at a wide scale before people find themselves in the emergency room. So I really looked for graduate programs in climate and health, and not that many existed. Now, I'm proud to say at GW, we're one of many schools that we have an MPH program in climate and health. We have a medical school training in climate and health. We have several classes that deal with different aspects of climate and health. And the students that we're getting in these programs, they are just so passionate and energetic and just soaking in all they can learn about different ways to address this problem in whatever career, whatever sector they're going to go in. And that's really what we need, because this is, as the previous speakers mentioned, this is a health problem. It's not just an energy problem. It's not just a political problem. It's not just an economic problem. This is a health problem. And whether you are an environmental health scientist or an epidemiologist or somebody, a health policy expert, somebody who's working in preventative and community care, or maternal and child health, or clinicians, all of the above, climate change touches what you do. And there's no way to find an area of health that is untouched by climate change. So I love what Vanessa Carey was talking about in terms of we need to train the health workers to bring this into whatever career pathway they are going to pursue. And I'm delighted to be joined at the table up here today by people who are doing exactly that. These are leading experts in a diverse array of organizations and types of work that they're doing, and they're bringing climate to their work. So I'm delighted to, and I'm going to introduce all of our speakers, and then we'll have some time for each of them to make some comments. We are joined virtually by Ari Bernstein, who is the director for the National Center for Environmental Health and the Agency for Toxic Substances and Disease Registry at the CDC. We are also joined by Cheryl Holder, who is the president of the Florida State Medical Association, founder and co-chair of Florida Clinicians for Climate Action, and co-chair of the Miami-Dade Heat Health Task Force. We have Joshua Weil, who is an emergency physician at Kaiser Hospital in Santa Rosa, and who was the incident commander responsible for evacuating Kaiser Hospital during a major wildfire. Neil Vora, who is a policy fellow at Conservation International, where he leads its efforts on pandemic prevention. And last but not least, Laura Kate Bender, who is Assistant Vice President at for Nationwide Healthy Air at American Lung Association. So, Dr. Bernstein, I'll turn it over to you.
Thanks so much, Susan. And it's always a great way to start a presentation by giving two apologies. The first is that I can't be there with so many old friends and many new ones in person. And the second is that given my obligations at CDC today, I have a hard stop, which may come just before the end of this panel. So if I disappear, please forgive me. But that said, it's been an incredible journey watching this work at NAM over the past year plus now. And I couldn't be more delighted, having spent so much of my career looking at climate and health. And Susan, I have the same sense that you do of how much the landscape has changed around climate and health in our academic institutions, as others have already mentioned about the engagement of so many parts of our society on these issues. And I think this process at NAM, among its many aspects that are laudable, are how it has brought together stakeholders. And Victor, I know we are all proud of the list of folks who have signed on, but surely we can do more. And I'm hopeful that with that groundswell support, we can reach even a broader audience. I want to talk for just a minute about work that we have been doing at CDC related to climate and health. Many of you are very familiar with the work CDC has done for a long time in this space. It is focused heavily on resilience. Just this week on Earth Day, we released a whole suite of resources related to heat. As many of you may know, heat is a huge public health challenge in the United States, and even more so in nations around the world. But as many speakers have already mentioned, whatever issue we see in the United States related to climate and health, we often see in greater measure overseas. But there are also communities in the United States which share disproportionate burden, and heat is certainly one of them. Last year, we estimated that 120,000 people were in emergency departments because of hot weather. That was just, I should mention, for heat-related illnesses. So that's excluding people who have, heart failure, who had to go to the emergency department for heart failure because they were exposed to heat. And of those 120,000, it's not, of course, a random sample of people in the United States. We know that those affected are those who often have adverse social determinants, whether that means they can't access or afford air conditioning, they are socially isolated, they are immobile, they can't get themselves to safety, or a host of other forces. Substance abuse, we have a huge national challenge with addressing the opiate epidemic. And the intersectionality of these issues, as Vanessa mentioned, is really foremost on our minds. So at CDC, we're very focused right now on the opiate epidemic, but we realized that, in Maricopa County last year, pretty much everyone who died either had a substance use disorder or was unhoused. And so in these resources we developed, we thought very hard about how we could try and get to the folks who may benefit most. And I'll just mention two pieces of this work. The first is the nation's first ever health-based heat forecast. So many of you will be familiar with heat alerts that are given by the National Weather Service. They often come a day or two before hot weather comes. These alerts are not based on health outcome data, but the new heat risk tool, which you can Google right now or look up at cdc.gov/heat risk, is able to give a 7-day forecast at a roughly 2-kilometer grid that uses the local relationships between health outcomes and heat to establish a color-coded risk for health in that area. And so this does a couple of things that I think are critical. One is, for the first time, we really know how hot is too hot in an easily understandable way. And we get more heads up, meaning we don't just get a day, we get 4, 5, 6 days advance notice. That means we can make plans. And the second piece is about plans. So to date, the mainstay of public health response to heat, as many of you well know, has been cooling centers. We know that cooling centers are not cited generally in environmental justice communities, and they generally aren't in rural communities. And so we really wanted to take a transformative approach to how we think about how do we reach farm workers? How might we engage with people who are experiencing homelessness? And that's where a partnership with the nation's community health centers that serve some 30 million people, including migrant farm worker communities. We launched these resources on Earth Day at a community health center, the Brentwood Clinic, which is a part of Unity Health in Washington, D.C., that focuses on caring for unhoused populations in the 5th District. And we see a real opportunity here to work directly with the healthcare delivery community in providing paths to safety, that we have a whole suite of tools to create heat action plans that are tailored in some cases to specific conditions, whether those are heart disease or asthma in children, women who are pregnant. And my hope is that as we enter warmer months, we'll see these resources, among others, that already came out and will be coming out, give us more opportunity to prevent what is fully preventable harm, especially in those communities that are most at risk. I want to acknowledge, though, that these resources are not just for health centers. They're not just for public health agencies. They're really for anyone who needs information about whether temperatures may be too hot for health, and of course, want some simple steps to take to protect themselves. The last thing I'll say is that this has been a wonderful collaboration across the federal government. So the heat risk tool is a reflection of a longstanding partnership between CDC and NOAA. In our guidance, we work closely with OCHI, and I want to acknowledge John Balbus and Carl Bell in particular for that. And of course, we worked with our colleagues at CDC at NIOSH, just to name a few. So with that, I will stop and gladly turn it back to Susan. Very excited for today's announcements and very grateful to be here virtually. Thanks again.
Thank you, Ari. And we will turn now to Cheryl Holder.
How's it? Good? Perfect. Well, good afternoon, everyone. I am really glad to be here. I've been with the collaborative for 2 years doing some of the pre-work that you saw, and I am happy that we are having this summit. 4 years ago, now I was thinking 4 years was a long time, then I heard the World Bank gentleman talked about 27 years before health was on COP. So I'm not so bad, because 4 years ago I was at TED Med talking about climate change, health, and equity, and then the pandemic happened. And I talked about things that we needed to do, including something like this, so I'm real excited. And hearing speakers like what we heard all day. And I said, one of the things we do as clinicians, that we must start with the stories our patients tell and the stories we tell on their behalf. And so since that time, with all of my, nope, not working. I want to advance, it doesn't seem to work. Oh, here we go. Will you advance, or? All my presentations, I start with Miss Anime, because that's not her picture, but she reminds me so much of the women I've taken care of over the last 40 years. I also went to GW, and I left in '84. It's a very different place. And in those 40 years, there's so much like Miss Anime, sweet women doing the best they can, straight talking. And so when she came in and asked me for a refill on a non-day that I know she usually doesn't do. I said, let me see what I can do. I squeeze her in. And then as we were done finishing up my prescription, she hands me another form and asks me, can I help her out with this form? She fell behind in her light bill. Now, this is so unusual for her, so I had to find out more. And the days and nights were so hot that she was using her AC in her old house in Opelika, and she was trying to breathe. And sometimes things happen. And I started looking back and saying, what is it? And Oprah Winfrey, if you watched Oprah years ago, she talked about the aha moment. And that was a moment that you unlearn things. Not that you were learning, but you unlearn things. And for that moment, and the 2016 when that happened to me, and it was so hot and more patients were telling me things, I had to unlearn that there are other factors that were causing my patients' ill health. And it wasn't that she wasn't using her inhaler properly and everything else that we were taught, but it was these hot days and nights, and they were happening in the US and all over. And then when I started telling her, you know, Miss Anime, there's even more to this. It's hundreds and hundreds of years of pollution in our atmosphere that is driving this change that we're seeing. And much of this pollution comes from places like the transportation system and the agriculture and the manufacturing. And for her, she really understood this. She may not have put it together to say all this stuff was making the planet sick, but she knew this stuff was making her sick and making her neighbors sick. And then when we talked about her asthma, like so many people in her community, her brothers and her cousins and her sons and everybody else who were sick, and then her church sister, Wimson, she said, died recently from an asthma attack. And she put it together that this whole thing came from so much of the pollution. So for her, and for so many of our communities, we know that these populations are living and exposed to so much more pollution. Their houses are inadequate, and they have tremendous more energy burdens. These are things that we know, and that Miss Anime and my patients were telling me. And then the population that most recently, and many of these are what we call those climate migrants, have moved into our country, and they are now at so much more risk, living in communities and states that are much more polluted and doing the work that puts them at even more risk. And so these vulnerable populations, as we call them, we know them, these low-wealth communities, these poor people. And, you know, I was telling Ms. Anime and some of my patients about these vulnerable pollutions, and if you know anything about some Southern Black women, they will give you a look. Nothing else. And I know that look meant, really, you're calling me vulnerable now? Or has something you've done made me vulnerable? And we know this is policy, and policy drives so much. Ms. Anime may not be able to articulate everything as well as we do, that where she lived, where she worked, where she played, her access to money and power, and the policies under which she lived drove her ill health. She can't say those definitions of social determinants of health, but she knew something happened, because she knew for hundreds of years that a European policy that enslaved people from another continent and then brought them to the New World and created a system and a structure that assigned value to humans. And in that assigning of the value, they were then left to struggle. And despite all the other policies that came and changes and policies that come, we leave people in living conditions that are sweltering. We also left them with lack of opportunity to money and power for so many laws, for so many hundreds of years. Now, I'm from Florida, so I'm gonna say this is not to embarrass and make any Europeans feel badly. It is just facts that with these policies, we have had a population now that how do they adapt without the dollars? And when I look at that map, and I love the mapping, and I love what Ari is talking about with the heat tool risk, because that just shows us where all the reds, and those are all the areas. Miss Anime lives right up in that red area. We see the arrows coming in, and that area is hot. It's been underserved. It has no trees. It has no anything. But she struggled, and she found a way to survive. And the solutions are many. And I love this one because this shows that personal responsibilities, because all these people in these communities have always understood their personal responsibilities because they have survived to this time. And then they want to understand the shared responsibilities, which we just heard so many of. And that is going to be how we're going to do it, through the collaboration. But we all have to step up with our responsibilities. And equitable solutions are key. And you've heard so many today, so I don't need to repeat them. But it does give us that opportunity to change that health systems that Vanessa Curry talked about, not just for us in the US, but for the world. And I leave you here with Jorge, because Jorge taught me something more, so just like Anime and all my other patients, and that's going to be our real key here in showing that why we keep doing this and we never give up. Because Jorge, he lived in that house in the back, on concrete, very little ventilation. He was undocumented. He sold oranges and limes on the streets with his acute kidney injuries when we talked about the heat and what he's going to do. And he died not from the actual kidneys, but from other things. But before he passed, he had that understanding, that the belief. Many of my patients come through and they will sometimes sing to me, God is not through with me yet. And when I hear that yet, I know there's a whole bunch of data that talks about that growth mindset. But that growth mindset is what keeps my patients in that hope and that love and that understanding for each other. And they always reach back to the next person and help the next person, no matter how difficult it is. And that's what Jorge came, and he did this interview with NPR. And that strength, that beautiful linens that he had on his bed, and he worked so hard and supported his family in all this heat because he knew that there's so many people like him. But there is hope. He knew we would be able to do it. And like this gentleman, Ian Roberts, said, that this is an incredible opportunity for improving. He wrote public health, but I see it as improving the world. So we have no more Animes and Jorge, but an entire world that is better because we have taken on the challenge of climate change. Thank you.
I can see how you're a TED speaker, really powerful and inspiring. Thank you. And we'll turn to Joshua Weil.
Great. Well, thanks for having me and inviting me today. I have to say I'm a little bit intimidated being here today in the kind of august panel. I feel like the movie character when the Earth is being attacked by the aliens and the president and all the world leaders and scientists are in the room, and they kind of pan over to the corner. Who's that frumpy guy with a baseball cap who's a sixth grade math teacher? And someone leans in and says, Madam President, he met the aliens and he can speak with them now. So I feel like I'll take the next slide. I am that character. Oh, I should point out that character is usually played by Matt Damon. So take that as you will. So I am an emergency physician practicing for about 27 years with Kaiser Permanente in Northern California, in Santa Rosa, a small community in Sonoma County. That's basically a suburban community, ball fields, sidewalks, not the area, we have some foothills, but it's not the area that you would imagine, that I ever imagined, that a wildfire would rip through our community and devastate it. But I was on duty the night of October 8th going into October 9th in 2017, and there was some smoke in the area, and it was a little bit odd. And it came to my attention where some of the locations of some of the fires were occurring, but it was still not really understood what was going on. But I realized that there was a fire about 3 miles from my house as the crow flies. So I called my wife and I said, get some things together, just in case. It's just a weird night out there. So 15 minutes later, I'm in a room with the patient, going over her x-ray, showing her how she didn't break her ankle. Apparently she broke her foot and I missed it, but she let me go on that, gave me a pass on that night. And my phone went off, and it was my neighbor. And he was just screaming at me, "Get out, get out, get out." And he had no idea that I was at work. And I ran out of the room, and I said, I got to call my wife, and I called her back. Only it was my 15-year-old daughter who answered the phone, and she was just screaming because my wife was in the house trying to find our pets, and the fire was surrounding them. And within a few minutes, she was driving down the hill and escaping through the flames. So you can see on the slides there what we faced that night. That was a kick in the teeth, and I was thrust into the role of being incident commander for the hospital and faced climate change and impact to healthcare directly on that night. We evacuated 123 patients, another 125 or so nurses, doctors, staff, EVS workers, phone operators, security, all the people who are in your hospital. And I think on a night like that, the impact of, or the intersection of healthcare and climate is fairly obvious, but what goes on after that, I think, is more subtle, and we've heard about a lot of it today. So in our community, over the next couple of years, I should say that I spent the next couple of years after that speaking at various events on disasters and evacuating a hospital, because this was a once-in-a-career event to be an incident commander for evacuating a hospital. But in 2019, the Kincaid fire came through our community, and we evacuated our hospital again. And in 2020, the glass fire affected one of our sister hospitals. I work for Kaiser Permanente, 21 hospitals in Northern California, and one of our sister hospitals was directly in the face of another fire. In Santa Rosa, we faced floods in the intervening years, and of course the pandemic. So it's one event after another stacked. And so some of those impacts are more insidious and less noticeable, but my hospital is an intermediate-sized hospital compared to the rest of the 21 hospitals in our facility. We're the third busiest hospital and emergency department when it comes to managing mental health. And I think that that kind of anxiety that goes on after events like this, just one stacked after another, is much more insidious and hard to recognize. And of course, we've heard today about some of the impacts on health, from heat illness, and very aware of those things. But I was really struck by what Pam mentioned from AstraZeneca, talking about prevention versus management. And of course, Kaiser Permanente is founded on the concept of prevention. Our health systems in the United States are not. We're a disease treatment-oriented system as opposed to a disease prevention. Now, I lost my home that night in 2017, and I rebuilt with battery backup, because when my wife was trying to find our pets, we didn't have any lights in our house. So we thought about those things. But think about the migrant farm workers in our community, and we have a lot, and they don't have that kind of backup. And because they face food insecurity and they don't have access to healthy food, then diabetes is more prevalent in those communities and those people. And when rolling blackouts occur, because we're experiencing more heat risk and more fire opportunities, and the PG&E will shut down the fire grids, my battery backup goes on. But for somebody who has diabetes because they don't have healthy food, and then they have insulin that's supposed to be refrigerated, and then the power goes out, and their insulin goes bad, they wind up in my emergency department in diabetic ketoacidosis. And instead of managing their diabetes, we're now treating them for several days in the intensive care unit at an astronomically higher cost. So that ripple effect through our systems goes on and on and on. And so it's much broader than that immediate kick in the face that I experienced in 2017, but those ongoing areas that we notice. And so what do we do to try to develop that resiliency and support our community? Well, Kaiser Permanente has invested about $24 million in our area, and it can be things like economic security, home rebuilding, developing a workforce, if someone can back that back up, thanks, a workforce, and drivers of different workforce opportunities, but also with recognizing the impact to mental health, and we've actually supported increasing crisis stabilization, as well as increased school counselors, because youth are really impacted by this, but also thinking about how we outreach some of those vulnerable communities and supporting actually an equity planner within the city council as part of city planning, and also recognizing that there are a lot of populations that simply don't have access to some of the things that we can do around early warning. If you don't have a cell phone or you can't charge your cell phone, you're not going to get the warning that now goes out. Or if you don't trust the various government entities and you don't want your cell phone number provided to those agencies, you may miss out on those warnings. So we also recognize the importance of supporting some of these communities systems that may outreach to those vulnerable populations in a way that they feel more trusting. So I happen to be the medical director of a free clinic in town that does not depend on government funds. And so there are a lot of undocumented people in the population who will come to us for vaccinations and for health care because they don't feel that they're going to be documented and feel at risk for deportation. So recognizing, Kaiser Permanente recognizes that need to support those systems and help support those. And so those are just a few examples of areas where we can make a difference as a community and as a healthcare system, reaching beyond some of the immediate impact.
Hi, everyone. Those are very inspiring talks before me, so it's a difficult act to follow. I'm a medical doctor, and I work at the interface of conservation and public health. And I first learned about public health thanks to my dad. He had smallpox when he was a kid, and thankfully he survived, which is why I'm here today. But he was the one who inspired me to pursue a career in public health, and so after I finished my internal medicine residency, I joined the CDC. And with CDC, I helped respond to the 2 biggest Ebola outbreaks ever. I led New York City's COVID contact tracing program. I had a team of over 3,000 people, and we traced over 750,000 people. It was a privilege of a lifetime. But during my time in public health, I also observed how the typical model in public health is to react to emerging infectious diseases. We wait for infectious diseases to emerge with the hope that robust surveillance can allow us to quickly detect these emerging infections so that we can then implement a rapid public health response. But as many of you in this room know, it's rarely that easy. Maybe a virus like the one that causes COVID spreads between people before they know they're sick. Or maybe people choose to not take a safe and effective vaccine. And before we know it, the outbreak grows into an epidemic or even pandemic. And as I stayed with this public health career, I also became increasingly concerned about the equity implications of this reactive model to emerging infections. Time and time again, the people who are most marginalized and who have the greatest need for the tools of response, whether we're talking about medicines, vaccines, or even information, have the least amount of access. Even now, years after Mpox and COVID began to spread globally, we still do not have equitable access to those vaccines. And so that made me wonder, and I know many others have wondered this before, whether there's a more equitable way to be approaching emerging infectious diseases, one that actually prevents these outbreaks from even happening in the first place, rather than just playing this game of catch-up. And that's why I, as a physician who still practices medicine, decided to join a conservation organization 3 years ago. And many people, when I tell them that I'm a doc working to save nature, they're surprised, but I actually see it very differently. For me, conservation is public health. Every time we protect nature, we are protecting ourselves, whether we're talking about saving cute furry animals like polar bears or fixing a hole in the ozone layer. There are human health benefits to those actions. And along those same lines, through strategic investments in nature, we can actually prevent the emergence of infectious diseases as well. And the reason for that is that most emerging infectious diseases are caused by pathogens that originate in animals and then spill over into people. And spillovers are on the rise globally because of human activities. Activities such as deforestation, commercial wildlife trade, unsafe practices when raising farmed animals. And these spillovers are increasingly occurring because of those precise activities. And then climate change is in the backdrop of all of this. Climate change exacerbates the spread of certain infectious diseases. Over half of known infectious diseases have been aggravated by climate change at some point. But there is good news here, because we have actions to actually prevent these spillovers in the first place by addressing those drivers. So by halting deforestation, by regulating commercial wildlife trade, by improving biosecurity when raising farmed animals. And this is equity. Preventing an outbreak from even happening protects people because we don't even have to wait and play that catch-up game. Right? It benefits people, particularly in resource-limited settings. Now, I'm not saying that we're going to be able to prevent every spillover event. That's impossible, but we can reduce their frequency. And that's why we also need to be investing in pandemic preparedness and response. So developing better vaccines and developing better surveillance. But what's clear to me is that the current reactive model is clearly not working, and it's inequitable, and we have to do better. And an added benefit of investing in these actions to prevent spillover is that they also can help to mitigate climate change. So it's like a 2-for-1 deal, where every dollar spent is a dollar that goes a really far away. It's a win-win situation. Now, I'm not sure how many conservationists in the room. Certainly for me, like before 3 years ago, I had no idea how to save a rainforest, and I still don't. It's amazing people who do that. But I want to give 2 examples to put a finer point on what I mean by when I describe actions like halting deforestation. And so the 2 examples, first one comes from Brazil. Back in the early 2000s, Brazilian government officials implemented integrated policy measures to protect the Amazon. And so they cracked down on illegal deforestation, and they returned territory to indigenous peoples who have successfully managed the Amazon for thousands of years. And those efforts paid off. From 2004 to 2012, deforestation rates in the Amazon plummeted by over 70%. And meanwhile, agricultural output increased, dispelling the myth that there's a trade-off between forests and food. The second example comes from Indonesian Borneo. So around a decade ago, this nonprofit called Health and Harmony conducted what it calls radical listening to arrive at community-driven solutions to deforestation. And so communities concluded that deforestation could be reversed if they had better health care and better quality jobs. And so this nonprofit and its partner built a clinic, and they invested in youth education, and they conducted alternatives jobs training. And lo and behold, those efforts worked. A decade later, the number of families engaging in deforestation was down by 90%. And meanwhile, health improved. Infant mortality dropped by 2/3. And so these examples show that people and planet do not need to be in conflict. And I think at its core, that's what this growing climate and health movement is all about, right? Trying to find how we can do good for both people and planet. But I also want to emphasize that we cannot take it for granted that nature will be an explicit part of this conversation. And that's what deeply concerns me, because nature is a necessary solution for progress at this intersection of climate and health. And one reason I say this is, again, I think it's a monumental achievement, but that climate and health declaration that was signed by over 140 countries last year at COP28 barely has any mention of nature. Actually, the word nature doesn't appear at all in the declaration. And that declaration does not emphasize that nature is a necessary condition to achieve success at that intersection of climate and health. And the same goes for the climate sector. If you look at the climate sector, over 30% of the solutions to our climate crisis come from nature-based solutions, yet those solutions receive less than 5% of overall funds. So just to wrap up, pandemics and climate change are symptoms of a planet in despair. And investing in nature is a critical condition for us is a critical solution for us to simultaneously address these existential threats. I'm not saying that nature will solve all of our problems, certainly not, but nature is a necessary condition. So if you're sitting in this room or you're listening online, you are probably in a very privileged, favorable, enviable position where you can make a difference in this world. And so my call to action is simple. Bring nature into your work. We need nature to survive. That is a fact, and we cannot avoid that, much to, I think, the dismay of many other types of interests out there. But we need nature to survive. And so ways you could do this, if you are a clinician, you can figure out ways to make your practice more sustainable while delivering amazing healthcare to your patients. Or if you're a policymaker, find ways to advocate for policies that are good for people and planet. Or if you get involved with this amazing National Academy new effort about the Grand Challenge, find ways to bring nature into that conversation. Thank you.
Hello, everyone. Following those incredibly inspiring stories, I now have the task of giving you numbers and federal regulations. So hi, everyone. I'm first going to share, hot off the presses, some results from the Lung Association's State of the Air report. The new edition came out yesterday. Then I'll talk a little bit about some of the federal policy landscape that I think provides a lot of reason for hope. And then I'll close with more numbers from another of our reports that highlight the benefits of solutions. So yesterday we put out our 25th edition of our State of the Air report. This report has the aim of making air pollution accessible to the general public, putting it into everyday language, and that's why we use letter grades and rankings to describe people's levels of ozone and particle pollution. We give grades to everybody that has an EPA monitor with official data. And if you take nothing else from this, lung.org/SOTA is where you can dig in further and find all this information. So what did we find this year? So number one, 131 million people live in an area that got a failing grade for one of those measures. That is nearly 4 in 10 people in this country. For a couple important reasons, that's higher than it was in last year's report. Almost 44 million people live in areas that fail all 3 measures that we grade for. And that's one of the places that we see a big health disparity. People of color were 2.3 times as likely as white people in this report to live in a county that got all 3 Fs. One of the trends we saw this year is that particle pollution spikes are getting worse. We look at short-term spikes in particle pollution, and what we found is that over the period covered by the report, so 2020, 2021, and 2022 are the data years this year's report covers, we saw the worst spikes in terms of severity in the report's history. Basically, we saw more days on which air pollution levels for particle pollution got to the maroon and purple, hazardous and very unhealthy levels of the air quality index. And that, of course, is tied to wildfire. We've seen a growing trend over recent reports that show that despite decades of progress under the Clean Air Act, despite all the work that the country has done to successfully clean up sources of pollution from power plants to vehicles, climate change is beginning to undo some of that air quality progress. It shows up in the spikes in air pollution, and then not so much this year, but in other years, we've also seen it show up in our ozone pollution levels. One, I think, good thing about one of the bad things in this report, we also saw a lot more people living in places that had unhealthy levels of annual or long-term particulate matter. And that's actually because of a policy change. So one of the things that many of the people in this room and the Lung Association have long advocated for is for tighter national limits on particle pollution. Earlier this year, the Environmental Protection Agency updated their standard. They made it tighter. That better reflects the health impact of breathing particle pollution on a day in, day out basis. And it means that a lot more people got Fs. So I'd say this year's report, on the one hand, it shows more than ever that spikes in air pollution driven by wildfire, driven by climate change are getting worse. But on the other hand, that progress that we've made from the federal policy perspective, it'll continue to reduce emissions, but it's also giving people better information about the quality of the air that they're breathing. So I mentioned federal policy, and I do want to take a moment to say that there's a lot of doom and gloom here, but we have seen some really significant federal policy victories over the past several months. We always do a recommendations for action section with the State of the Air report. Last year's report, quite frankly, had a laundry list for the U.S. Environmental Protection Agency in particular, a long list of regulations that we were told we should prioritize, shorten, and we said, no, we can't, these are all critical. Well, I'm really excited to say that almost all of them are now across the finish line as of this morning. So I mentioned that EPA updated those national particle pollution limits. They finalized rules to clean up methane from the oil and gas industry, which will also result in other harmful pollutants being cleaned up at the same time. We've seen stronger standards for cleaner cars and cleaner trucks get across the finish line just in the last couple months. And then literally this morning, as you heard from climate advisor Ali Zaidi, EPA finalized measures to clean up carbon pollution from the power sector, as well as more mercury and air toxic emissions reductions from the power sector. That would not have been possible without all the work of people in this room and advocates across the country telling the health story of climate change impacts. As you can tell from my presentation compared to my co-panelists, the story is the compelling part. Those are the pieces that people remember, and that applies to our policymakers too. And you could see in the rollout even this morning that health was front and center because, from the folks at EPA to other policymakers across the country, they get that health is the most compelling way to shine a spotlight on the impacts of climate change. Of course, there's been a lot of talk today about the Inflation Reduction Act with investments rolling out to the healthcare sector and beyond. That's another critical victory that's still in the works. EPA hasn't done everything that we wanted. So next on the to-do list, they need to update the national ozone standards, just like they updated the particle pollution standards. And then we all should acknowledge that the work is not done when stronger standards get officially finalized and make it across the finish line. Now they need to be implemented, they need to be defended from those who seek to undo them. But it's on all of us to make sure that the protections that are promised in these rules actually turn into reality in communities across the country. And finally, I promised one more report resource. A couple of years ago now, the Lung Association put out a report that shines a spotlight on solutions. Our State of the Air report is all about the problem. We released Zeroing In on Healthy Air at lung.org/EV, along with a series of companion reports over the years that shine a spotlight on the solution. And that solution is a nationwide transition to zero-emission electricity and transportation. We looked at a future in which if we got all of our new cars being sold to be zero-emission vehicles, if we got all of our new vans and trucks being sold to be zero-emission vehicles, and if we got all of our power from clean, non-combustion sources, so we stopped burning stuff for electricity, what would the health impacts of that transition be? A lot. So the total cumulative value of public health benefit, so the dollar value of the lives saved and the health impacts avoided, is more than $1 trillion over a 30-year period. It's 110,000 premature deaths avoided, 2.7 million asthma attacks avoided, and 13.4 million lost days of work avoided. Those are the numbers, but of course the stories show the real health impact and the benefits of this future. So we're excited about the progress that EPA and the rest of the federal government is making to get us closer to this future, but we clearly still have a lot of work to do to implement it and to make this future a reality. Thank you.
Well, thank you so much to our speakers. I have to hand it to the organizers. They've compiled a panel with incredible stories and the data that we need. We need both, so thank you very much. We are running a bit behind, so we will take two questions, one from the room and one from any web listeners, if we have any. So do we have any questions in the room? Yes. Oh, you may want to go to the microphone right there.
I'm Jeremy Hess. I'm an emergency physician. I work at UW-Medicine, University of Washington in Seattle. And Susan, you started out by talking about how much things have changed, and it was a hopeful note that so many more people are interested in climate and health, which I see too. And we have a lot more resources for them, and that's great. And then we heard a lot of, frankly, sad stories about loss. And I'd like to ask the panel their thoughts about that. I think that particularly in medicine, we have ways that we deal with loss. We have palliative care. And I think we need to expand the discussion a bit because we're facing a lot of loss that's going to be unmanaged. And I'd like to hear your thoughts.
Yeah, definitely loss is real. And that's one thing I show again with the patients that I work with. Is you see the data, you know who's been impacted for many, many years, yet there is a resilience within the communities. And I have found that resilience is in the values and the meanings and how they build communities. And I think within that, you have the ability to overcome loss. So yes, there will be sadness, but it can be overcome and you can turn it into ways of continue to survive. So that's where you continue to get up and work hard. Jorge used to tell me, rain or shine, cold or heat, I gotta work. But he did it in a way because he worked for his family, he worked for his community, he worked for his church. And I think in that way we can find the understanding of how we can live with the loss, but not get depressed, not give up, and continue to be hopeful and continue to work to make sure that it's going to get better? Because there is a real strong belief, and I know I have it, that we're going to do okay.
So thanks for the question. It's a challenging one. I suffered a great deal of loss on October 8th and 9th, 2017. But my family was okay, and we saved the dogs. And my to-do list got a lot shorter. I make a joke of it, but that's part of the way you get through it, right? And you know that in emergency medicine, you people see us laughing and stuff. It's not that we're laughing at people, but you have to, when you face difficult times on a daily basis, you have to find coping mechanisms. And one of the things that I would say that came out of the fire was that that I'd never seen our community so bonded as I did in the days and weeks and months and even years as it was after the fire. So some of the stories and analogy I make is that in my misspent youth, I worked at a marine lab in Jamaica, and I ran out of air at 60 feet on a dive. And if anyone knows anything about diving, you should never run out of air. But I did. And my buddy and I did exactly as we were taught, buddy breathing on our way to the surface. And we got to the top. I laughed, and I was a better diver from that day on because I knew I had faced a challenging situation and I had gotten through it. And I felt much the same way about our community. We faced a horrifically challenging situation and we got through it. And so now when I come to an event like this today, and I see all these great minds and all these amazing projects that people are working on, I'm actually filled with hope, and I think that there is a way out, and I don't feel that it's just sadness, but that there is, I know it's trite to say, but there is light at the end of the tunnel, and I'm always telling people to stay away from the light, so at the end of the tunnel. So.
Just to quickly build on those two beautiful answers, for me, there's two thoughts on that. Number one is, along what you're saying, which is action is the antidote to despair. I was facing so much eco-anxiety, climate anxiety, until I finally dived into this new career 3 years ago. And the solutions to the existential threats we face from pandemics, climate change, the mass extinction are not going to come from any single discipline. But when we break down those silos and we start working together, you see the amazing people all around you working towards solutions, and there's so many amazing things going on right now. I've never been more hopeful. And the second thing, to build on what you were saying, Cheryl, about finding community and working for something greater, in the book How to Change Your Mind by Michael Pollan, he defines spirituality as the opposite of like the ego. So looking for something bigger, and however you define spirituality, but tapping into something bigger than ourselves, I think, is just so important.
Thank you. Do we have any online questions?
We don't have any online questions, so we do welcome one more question from the room. If you prefer not to stand, we can bring you a handheld mic.
Looks like we've...
Okay, my colleague over here is going to bring you a mic. So you.
Hi, I'm Lil Milagro with Mycelium Youth Network. We work to prepare young people for climate change through climate adaptation and mitigation education. And one of the things I really appreciated about the panel was the moments where y'all were talking about what it means for young people, especially when we're thinking about the significant impact that climate anxiety is having on young people. Even going back to the Bath study, University of Bath study that said 53% felt that humanity was doomed. And so when I think about what it means to work with young people and to build in solutions, seeing the ways in which no matter what their socioeconomic class, race, background, they're all going to be affected by climate change. And so I was wondering if you can talk about how each of you, or in your organizations, how you work with young people to help transform culture. So how are we creating solutions that are current, but also looking to do longer scale cultural transformation so we don't just do business as usual, but with a climate and health impact, but how are we really trying to sustain and transform entire systems using the voice and the actions of young people?
I'll tell you, at Florida Clinicians, for the same reason, we're all clinicians, and we recognize the anxiety and we recognize the stressors. Much in the poorer communities, they may not express climate anxiety because of so many other competing negativity, but it still comes down to having that sense that things aren't quite right. So we developed the Climate Health Outreach Team. And with that team, we take kids from high school, at least 16, through medical school, and we bring them into our group, and they go through an online training, and then we have them do a little video, a mock video of what you would like to go out and teach your community. And we give them the information on heat and health. So they're armed with the information, and then when we go out together, and we usually do it Saturdays, we have adults with them, doctor or a nurse or somebody else, and creating that community that we've all talked about, that we've seen happen and that works, and in creating that community, they get a sense of an action, and hopefully we're going to do some studies later and see, do they feel like they're now able to do more for their community? Are they able to feel like they have some agency over this? And also being with older people, it makes you realize that, you know, you're going to get so many stressors, and why it's so anxious now, this might be your earliest one. But, you know, especially with me, I've been through HIV, I've been through coronavirus, you know, all these things. And I'm like, you know, this is not my first rodeo, but trust me, the outcomes have been great so far. And working together, that's what we're hoping will help give them something to do, bring them to the community, bring them with the spectrum of ages, not just their little people, their young people, but with the older people, and especially some of my older black women. I have some black nurses on my team that would just be like, nope, 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 let's get together here. And it just, that sense of community is what I use.
Well, I mean, I wholeheartedly agree with those comments by Dr. Holder. I mean, so much of feeling that you have a hand in the change is really what makes people feel more confident. So if you were just a bystander, it's very hard to feel optimistic about the future. But if you were engaged in making the change, then that gives you something to be hopeful about. And so in that regard, on the slide we mentioned a little bit around locally in our community in Santa Rosa and Sonoma County, that Kaiser Permanente actually supports job training around climate resiliency, and that can be both for like infrastructure building and helping with housing, but as well as healthcare aspects. So those are all opportunities to have a hand in making a difference, and I think that's probably the best way to engage the incredible power of youth. I mean, I'm counting on youth to keep things going for me, so as I no longer fall into that category. I think that's where we see the opportunity. And you know, and I also mentioned, obviously, there is, from my perspective in medicine, the need for providing mental health support as well, in the many ways that may look. And so again, we are supporting school counselors as well as trying to improve access to care. And mental health access is also, again, when we think about the web that we weave around climate and health, that's a very vulnerable population. They often don't have access to health care. They often are underhoused or unhoused. And that's been an effort that we've been involved with, making sure there's more housing available. But also a lot of times medications that people are on when they're dealing with mental health make them more vulnerable to heat illness and some other things. So there's no single answer, and it's important, I think, to recognize the very complex web that is weaved between climate and health.
I think we should leave it there. Thank you so much to this wonderful panel. And I believe we have a 10-minute break coming up.
I will give quick updates. All right, so as you can tell, we are running a little behind. We do want to get a very, very short break. There are some snacks outside. It's 3:46, so we'll be back starting right at 3:55. So enjoy the break, snacks, and then be back at 3:55.